Cât este vinovăție, cât este preconcepție și cât este răutate în felul în care, până la urmă, îi judecăm pe toți cei care au o greutate peste medie sau sunt chiar încadrați științific, medical, în zona de obezitate. Pot ei singuri să se descurce și să se vindece sau este o chestiune unde ai nevoie de medic? Este lipsă de bun simț, chiar nesimțire, spun unii, faptul că tot iei în greutate și mănânci fără să te oprești? Este o chestiune pe care o rezolvi în momentul în care ai o balanță între ce intră și ce iese? Toate răspunsurile, sau măcar parte dintre ele, o să le primim acum de la profesorul ARYA SHARMA. El este profesor emeritus of medicine and past chair in obesity research and management la Universitatea Alberta din Edmonton, Canada, și past clinical co-chair of the Alberta Health Services Obesity Program. Beyond all this, Professor, thank you very, very much for accepting this interview. You are a well-recognized worldwide professor and doctor and a perfect speaker. I was impressed with your speech early today. So my first question is, what is obesity?
Well, obesity is when your body fat affects your health. That's the simplest explanation. So when you have a health problem that is driven by the presence of excess body fat or the type of body fat that you have, then that becomes a medical problem, and that's what we really call obesity.
Basically, if I'm too fat, I'm obese? Or
No,
it's just that?
It's not just the amount of fat, it's the kind of fat. So see, fat is a very complex tissue. If you want, we have three types of body fat. We have the body fat which is under your skin. Mm-hmm. This is the one you can pinch. That is actually good body fat. That's very good body fat to have. You might not like the appearance, but it is actually healthy body fat.
It's the one we see at kids when
yes,
the
chubbiness,
yes.
right? That is healthy fat. Okay. That is good fat, if you want.
So in a way, I'm sorry, when we say, well, it's a fat child, it's a healthy child, it's
up to a certain age.
It's up to a certain age.
Up to a certain age.
Which
okay?
age?
And up to a certain amount.
Okay.
So that's good fat. But then there's fat which is inside your abdomen. This can be the fat that is, it's inside your abdomen. It can be around your heart. It can be around your kidneys. And we call that visceral fat. So that is fat that is around your organs. A little bit of that is healthy. But when that gets to be too much, you start having medical problems. And then there's a third problem with fat, and that is when you start putting fat in organs which normally would not have fat. And the best example, so when you start putting fat in your liver, when you put fat in your skeletal muscle, when you put fat in your pancreas, in your heart muscle, that's when you start having medical problems. And so it's not, so it's important to understand that it's not the amount of fat. You can have a lot of body fat but not have medical problems, or you can have a small increase in your body fat and start having a lot of medical problems. And I think that's what makes the whole discussion around obesity so complex, that there's not one number. When people ask me, so
golden number.
There's no golden number when people say, okay, how much body fat is healthy? I said that depends very much on the kind of body fat that you have. If you have the wrong kind of body fat, you're going to have problems. That's unhealthy. If you have the right type of body fat, that's probably healthy.
Until which age a child with that chubbiness, it's okay?
It's an early age, right? I mean, it's once you get to so toddler age is okay. Once you
2
get,
years.
Yeah, once you get beyond that, it can become a problem. And what we do know is that for many kids who initially have weight issues beyond the age of being a toddler, that can become their risk for having obesity when they get older is much higher. And so that's why there's a lot of concern about childhood obesity. But I'm not a pediatrician, so I don't look at kids.
It was just a curiosity,
Sure.
just an information. Around toddler age, this is the age from which we should not say if it is a fat child, then it's a healthy child. Anyway, the pediatrician will decide. Thank you very much, Professor, but it was just a curiosity. Coming back to what causes obesity?
Okay, that's interesting. So So the causes of obesity, so the reasons why somebody gains weight can be very, very diverse. Now, of course, you can say, well, they eat too much.
Yeah.
Fine. But that eating too much is a symptom. It's not the cause of obesity. That's like saying, what is the cause of depression? Well, it's not being happy. No, not being happy is not the cause of depression. Not being happy is a symptom of depression. And in the same way, when somebody is eating too much, the question is, why is this person eating too much? Now that becomes then complicated, right? Is it someone who has a lot of stress? Is it someone who has lack of sleep? Mm-hmm. Is it someone who has no sense of satiety, so they eat but they never feel full? Is it someone who's hungry all the time? Is it someone who has a lot of cravings? Is it someone who's taking medication that is causing them to increasing their appetite? Is it genetic? We have many genetic forms of obesity where people are just hungry all the time and they can eat how much they want, they're still hungry. So the reasons why people gain weight can be very, very different between different people, right? And what's also interesting about obesity is that obesity can happen at any age. So, and this is very frustrating for some people because a lot of people say, you know what, till I was 30, I never had a weight problem. And then suddenly I gain weight. Mm-hmm. Or somebody tells you, I never had a weight problem till my second pregnancy, mm-hmm. which was complicated and whatever. And then since then I've been struggling with my weight. Or people will tell you, I never had a weight problem till I got into a car accident and then I injured my neck and now I have chronic pain and now I cannot sleep at night and and that's what happened. And before that I was very healthy. And one of the unfortunate things I would say that we have learned about obesity is that not only can you get it at any point in your life, even if you never had a weight problem before, it can happen when you are 30, 40, 50, 60. And even people who live very healthy lives are not immune to obesity. And this is not a good message for prevention because when I look at my own clinic, I've had athletes in my clinic, right? I've had soldiers in my clinics. I mean, these are the fittest people, best trained people, lots of physical activity, very healthy diets, very focused on nutrition, all of that. And then something happens. They have an accident, they have an injury. We talk about soldiers going to Afghanistan, there's trauma. Something just happens in their life and next thing you know, they have obesity.
Something emotional maybe.
Could be emotional, it could be a diagnosis, could be families breaking up, who knows what happens, right? And so living very, very healthy before did not protect them from obesity. Because obesity can happen to the healthiest person. And we see this, and this is not rare, right? I mean, I've had lots of patients who have been extremely healthy, very food conscious, never had a weight problem, always very active, always, and then something happens, right? And the next thing you know, they've gained weight and now they're struggling, right? So living healthy and being physically active, unfortunately,
it's not enough.
Does not mean that you will never have obesity.
How can we deal with it? How can we cure it? We know we have the diagnostic, yeah. It's a disease. And after that, what?
So the problem with curing obesity is that our bodies will protect its weight, right? So we can look at this from an evolutionary perspective, that losing weight is not something that bodies like to do. That's what I explain to my patients, right? I mean, bodies like to gain weight, but they don't like to lose it. And in fact, when you try to lose the weight, your body is going to fight you. So there's a very complex biology that actually defends us against weight loss. And people experience this. So when I started diet, first week of my diet, I'm very happy I lost 5 kilos. Great, things are going good. Second week, 4 kilos, still okay. Then I come to, third, fourth week, now I'm only losing 3 kilos a week. Okay, I'm still doing the same thing, I'm still same diet, same exercise. Then I come to the 5th or 6th week, now I'm only losing 1 kilo. So, okay, what's going on, right? So it doesn't become easier to lose weight the more weight I lose. No, in fact, actually, I lose less and less weight, although I'm doing the same thing. So what is happening? What is happening is my body is defending its body weight. And the analogy I use here is this is your body weight, and it's like you're pulling on a rubber band. So when I go on a diet, I start pulling on this rubber band, and my weight is going down, but the more I pull, the harder it becomes to pull, right? But it's still a rubber band. So I get here, now I'm just struggling to hold it here, and then if I start releasing, I start relaxing because, and then it starts going back. And if I lose, boom, I'm back to where I started, right? And the tension in that rubber band, what is the tension in that? That's your biology that is defending you against weight loss, and which is basically guaranteeing you that when I stop pulling, my weight's going to go back right to where I started.
Basically, because my system is protecting me and my life.
That's
they
what
are assimilating life with the weight.
Exactly, because that's what the biology does. The biology is not there to protect you from weight gain. The biology is there to protect you from weight loss. And anytime you try to lose weight, that biology is going to work against you. And unfortunately, the weight that it is protecting you from tends to be, for most people, the highest weight that you've reached in your life, not counting pregnancies.
Whoa.
Okay? So pregnancy is actually one of those, probably almost the only situation in which you can gain a lot of weight and you can lose that weight with no problem.
Okay.
It doesn't happen to most women or many women.
The message for the brain and for the whole biology is that
is still your
you
normal
have a job
weight.
to deliver the baby.
Deliver the baby, and then we go back to your original
Okay.
weight, right? And so we see this in women. I mean, you see women, they look,
Yes.
after 3-4 kids, they still look exactly the same as before,
Exactly.
right? So, although they gained a lot of weight in pregnancy, their weight comes back down and there's no problem, right? But that is the only exception. In most other cases, when you gain weight, the body will actually readjust its set point to that higher weight and will start defending it, right? And the body does not care how you got to 100 kilos. Right? I said there's many ways to get to 100 kilos, but once you get to 100 kilos, then your body thinks, okay, 100 kilos is 100 kilos, so now we defend 100 kilos. And now you're stuck at 100 kilos. And whatever you do, you're always pulling the rubber band, but your body always wants to go back to 100 kilos. And that becomes a lifelong problem, and that's why we talk about it as a chronic disease.
How can we fight it? Be more specific.
Okay.
You have surgery, you have some medicine.
So the key to fighting it is, well, I basically have two choices. When you use the rubber band example, I have two choices.
And live like that? I mean,
Yeah,
and
I can
frustrated and...
Yeah, I mean, I can pull, and then I can keep pulling. Right? Now, if I only have to pull this much, I can do it. If I have to pull this much, that becomes more and more difficult, right? So the more weight I have to lose, the harder it becomes to pull, the more effort it's going to take, and the bigger my risk of weight regain, right? But that some people can do it, right? Some people say, okay, I change everything in my life, I start running marathons, I get very strict on my food intake, I count my calories, I obsess about my food. That's one thing. Very few people can succeed with that in the long term, right? And that we see that out of 20 people who pull the rubber band, 19 of them are going to go back to where they started, right? One guy can keep pulling, that's fine. Experience is that even that guy will not pull forever, right? Like he can pull for 5 years, 10 years, 20 years, but then at some point, if he ever lets go, probably go back to where he started.
And even after 10 or 20 years...
Yeah, the body is not going to change what it wants to be, right? That does not happen, unfortunately, right? I mean, at least for most people. So some people might happen. But the default condition is that, and that's what the evidence shows, is that most people who lose weight sooner or later will end up back at the weight they started from, if not higher. Okay, because when you look at time, people get older and things happen. Okay, so that's the one way. Now the other way to make this possible, of course, is if you think of this as a rubber band, and the reason that I cannot maintain my weight is because of the tension in the rubber band. If I can find a way to reduce the tension in the rubber band, my chance of success is going to be much bigger. Mm-hmm. And that is what the surgery and the medication does. So the reason that the surgery and the medication does is that this tightness in the rubber band suddenly is relaxed. And so without the surgery or without the medication, I'm pulling, it takes me a lot of effort. With the surgery and medication, I can do this with 2 hands. Mm-hmm. Now it's easy, right? So now I can, I can have the conversation and I can still maintain my weight because the tension is gone. Now, if I take away the medication or I take away the surgeon, the tension comes back and I'm going back, right? And that's that's basically sort of the model that we work with, saying that, you know, your biology is the problem, and if I don't address the tension in the rubber band, which I can do with medication or surgery or both, then I make it so much easier for the patient not only to lose the weight but actually to sustain significant weight loss. But this only works as long as I
continue to do it.
Well, as long as the tension is not there. When the tension comes back, I have the same problem as before.
Well, talking about medication and surgery, there is a level of bullying socially for those who doesn't have the willpower to
Sure.
get rid of the weight alone
Yeah.
and work with their body.
So the biggest myth, I think, in this whole obesity business is that people who are not losing weight don't have enough willpower, are not motivated, and are not trying.
Mm-hmm.
And when I just think of my own patients, I mean, I have hardly ever met a patient who has not tried to lose weight. And sometimes I meet patients, they have lost more weight than they actually have. So you meet a patient who's 100 kilos, if you look at how often have they lost weight, they might have lost 120 kilos in the term of life. Every time they lose 10 kilos, they put it back on, then they lose 20 kilos, put it back on, they lose another 5 kilos, put it back on. So if you total the total amount of weight, they've lost 150 kilos, right? So we can't say they're not motivated because it's difficult. We can't say they're not trying because they're trying. Every time they're trying, right? So that's not true. And then we're saying, oh yeah, but then maybe they're not trying hard enough. No, they are trying hard enough, right? And very often when you meet people who are not trying and you talk to them, you find out they've given up trying. Why? Because it never works, right? So if you keep doing the same thing and it never works, then, you know, what does a smart person do? They
Give
stop.
up.
They stop trying. Why would I keep doing something that's not working, right? And so this misconception that you have that people are not trying very often is that they've given up. They said, this is not working, I can't do this, forget it. There are some people who have never tried. For them it has never really been a concern, and so they haven't tried yet. But my experience has been that most people who start having health concerns, because people are not stupid, I mean, they know that their weight is affecting their health. I mean, this is not, I mean, if I have pains in my knees, you know, and I'm carrying 100 kilos, I don't have to be, you know, a rocket scientist to know that, well, that weight is not good for my knee, right? So I think the main issue is not the lack of motivation or even the lack of knowledge. I mean, yes, we talk a lot about the lack of knowledge and people should be more educated about health and exercise and physical activity and stuff. But in my personal experience, that has never been the central issue, right? It has been the issue for some patients. I mean, I had one patient who put on a lot of weight, and it was quite interesting to find out that he was an Uber driver. And when he was waiting for rides, he had a big bag of pistachio chips, pistachio nuts. And he would eat 1 bag, 2 bags, 3 bags a day just because he was bored. And then
It's healthy. Pistachio is
yeah,
healthy.
and he gained weight. Okay, and he had not realized how many calories are in those nuts because he thought, okay, this is healthy, right? No, but that was, you know, 2,000 extra calories every day, right? So you find those type of patients, right? I mean, sometimes you find a patient who really has not fully recognized. So they think they're healthy. They drink a lot of juice. They don't drink, you know, no soft drinks. I only drink juice. It's healthy, but juice can have as many calories as pop, right? So yes, you find some of those patients who don't know these things, right? But that is not the majority of patients, and that is usually not the main reason why there's a problem.
And the medication is helping me also managing all these unhealthy habits. I
Yeah,
presume.
because what the medication does is, I mean, the medication puts you in a state. It fools your brain into thinking you've had a large meal when actually you haven't.
So everything is here, in fact.
Oh yeah, I mean, obesity happens in your head, right? I mean, we know the center that regulates your body weight. So we are talking about centers of the brain that are deep inside your brain. You don't have any conscious control over those centers, right? technical term, we call it the hypothalamus, right? It's a very small part of the brain, but in that small part of the brain controls your appetite, your hunger, your satiety, and many other functions of your body, right? That's how bodies work. And you don't have any control of that, right? I mean, me educating you or motivating you does not change the biology of that center. And then we have other centers, the hedonic center, which is more about reward, which really doesn't care about weight. It cares about pleasure and reward and emotions.
Eating a cake,
at celebrating.
Midnight, an ice cream.
Yeah. So we have people eat when they're happy, people eat when they're sad.
Yeah.
And that is not the same for everybody, right? Some people, when they are anxious, they stop eating. Some people, when they're anxious, they have to eat. Same as for depression. Some people have depression, they stop eating. Some people get depression, they eat. So there's a lot of individual variability in the link between what happens in your emotional system, hedonic system, reward system, and how does that translate into behavior. So
you were saying that medication is going there to the brain.
All of the medications that we currently have that work for obesity have an action, a central action, because that's where these things happen, right? Obesity happens in the brain, and so the medication that you need has to work on the brain. If it doesn't work on the brain, it's probably not going to do anything.
Yeah, I've wrote down something you said. If you have depression, you cannot be treated for obesity. If you have anxiety, you cannot be treated. You have to treat first the anxiety or the depression.
Yeah, so whatever is contributing to the weight gain, I mean, you want to address those things first, right? And take depression as an example, right? So depression, of course, means that depression affects my sleep, it affects my activity levels, it affects my emotions, it affects my metabolism. And that is going to make any kind of weight loss difficult, right? And so when I have a patient who has got severe depression, I need to manage the depression as part of their obesity management, right? The same would go for anxiety, the same would go for someone who has, I don't know, a binge eating disorder, or somebody who has an attention deficit disorder with impulse control issues. I mean, these are all issues that I need to recognize, and they can be part of obesity management. Because when you don't address those issues, then managing obesity can be difficult. But fortunately, not everybody who has obesity has depression or anxiety or any of those issues. Fortunately, right? So we don't need mental health in every single patient. I don't have to send every patient who has obesity to see a psychologist, right? That I don't have to do that.
The idea is that everything is in the brain, and
everything can be important, right? Chronic pain can be important. Lots of things can be important, and that's what makes the field of obesity medicine so interesting, right? That every patient is different. Every patient has their own problems. Every patient has their own set of reasons on why they have gained weight, how they deal with the weight, how the weight is affecting their health, and so that keeps it interesting.
Tell me about the cold pizza phenomena, or the cold pizza reaction.
Okay, so one of the tricks your brain has in trying to help you maintain your weight. So when you don't eat, so I'm too busy, I have no time to eating, or I'm starving, or fasting, I'm skipping meals to try to lose weight, whatever the reason is that you haven't eaten, your homeostatic system, which is the part of the brain that is trying to protect you from weight gain, first thing it will do is it increases your hunger. Okay, so when you get hungry, you're reminded, oh, okay, I'm hungry, now I need to think of eating and I have to start looking for food. But one of the tricks that the homeostatic part of the brain actually uses to get you to go and look for food is it activates your reward system, right? So the reward value of food actually increases when I'm hungry. And what that really means is that when I'm hungry, foods that I would normally not eat, would not be my preference, suddenly become very attractive. And I use the cold pizza example of someone who, you haven't eaten all day, you come home in the evening, you're hungry, you're starving, and you go to and you're going to the fridge and you're hoping that there's still some pizza left from last night, right? Nobody's hoping, oh, nobody finished the salad. No, you're thinking, hopefully there's some pizza. And then you find the pizza and it's cold pizza, and then even on the way to the microwave, you're already taking a few bites because you're hungry. Right? Now, why would anybody eat cold pizza? And why
so good.
It's so good, but why is it so good? right? It is so good because I'm hungry, right?
Very hungry.
I'm very hungry, and the hungrier I get, the more attractive this becomes, right? And that's how the body works, right? I mean, because what the body is trying to do is they're saying, okay, there's no calories, so we need to make you to go out. And that's why the reward system is such an important, because part of why you go looking for the food is because of the reward that's associated with the food, right? That's why it's the reward system, right? So now the reward of finding food, and you can see this if people are starving, if you're really hungry, and you go to and you come home, hopefully nobody finished the pizza, but then you open the fridge and the kids have eaten the pizza, there's no pizza, now what do I look? Now you start looking, no, okay, there's nothing in the fridge, okay. Now I open the cupboard, okay, hopefully there's some chips, or they've also eaten the chips, now what do I do? And you're starting to look for food, right? In fact, if there's no food, you will get back to your car, you will drive and buy something, right? Because that's your reward system changing your behavior, because the homeostatic system is telling the reward system, hey guys, we need food.
Food now.
Right? It's not rocket science, right? But it's biology. This behavior is driven by an underlying biology that is there to actually make sure that you survive.
Please explain to me all the adverse effects we are talking about on GLP-1, for example. We are talking about, I don't know, nausea. On the other hand, the GLP-1 face and the GLP-1 skin. And
yeah. Okay. So let's talk about nausea, face, and skin. Okay. The nausea is an effect of the medication. So the medication is a hormone, right? And this is the same hormone that is produced by your stomach when you eat a meal. And part of what this hormone does, it tells the brain I'm full. It also changes the action of the stomach, so the stomach, the contraction of the stomach is delayed. And what that means is that I can feel full, and a strong sense of fullness can actually be nausea. Okay? That's what this hormone does. So the way that we deal with this in clinics is we start with a very small dose, and we start with a very small dose, which we then slowly increase in the patients to tolerate, and most patients will then tolerate it. Okay, so the nausea is part of what the medication does. Mm-hmm. The face changes has nothing to do with the medication. The changes in the face that happen is when people lose weight, they lose weight in their face also, so the face starts looking thin. That is not an effect of the medication. If you lose weight by running a marathon, your face will be the exact same. If you lose weight by having bariatric surgery, by doing keto diet,
it's the same.
It's
face.
the same, right?
You're right.
So the social media likes to call it the GLP face, but it's not the GLP face. I could call this the diet face, all right? Yeah. Right. So and the same is there for the skin. The skin can become dry. Again, that happens irrespective of the weight loss. Anybody who loses muscle loss. Anybody who loses a lot of weight, you lose muscle mass. You might have some hair loss. Thankfully, the hair usually grows back. It's temporary. They can have dry skin, you can have problems with your nails, and you have to see
it's a shock for the body.
It's a shock for the body, right? But that is not because of the medication, that is because of the weight loss and the fact that you're eating less than you were eating before and you're losing weight, right? And that will happen with any kind of weight loss. So it's not, we are seeing it more often now because more people are losing weight because they're on the medication, but it's not really an effect of the medication, that's an effect of losing weight.
It's for a lifetime, this medication, in different dosage. I mean, when you stop.
Well, we come back to the rubber band, right? I mean, it reduces the tension. This is much easier for me. Some people, maybe if I take away the medication, maybe they will, be more successful. But for most people, when you take away the medication, the rubber band tension is back, and I'm going back to rest. And that's what the studies show. Most of the studies show that when I stop the medication, of course, the hunger comes back and
everything.
Yeah. See, medication works when you take it.
The food noise. We haven't spoken about the food noise.
Let's talk about the food noise.
When you have it I have it in my head now, because things are changing with the age, with all the hormonal changes in the body, and I have a voice inside my head who's saying all the time, let's eat something good, maybe a little bit of chocolate, maybe something sweet, maybe something salty. Let's eat. What can we do with that noise?
Yeah. So food noise is not just thinking about what I want to eat.
No.
Food noise is also trying to avoid eating. Food noise can also be guilt about what I just ate.
Yeah.
So, I just ate, but I shouldn't have eaten this or something else. Or I'm thinking about planning meals. I'm thinking about skipping.
Thinking about food all the time.
Somehow food is in my head, right? That's food noise. And it can be very loud, right? So constantly thinking about food. And the interesting thing we have seen is both with bariatric surgery and with these medications, there's silence. Right, and for patients that can be a shock. Wow, it's certainly it's quiet.
You don't wake up thinking about food.
I don't wake up thinking about. I don't go to sleep thinking about food. I don't think about food between meals. I don't. No, it's food is just food, right? And people who don't have food noise cannot imagine what it's like for the people where there's constantly have the food noise, right?
That's true.
And for people who have the food noise, they cannot imagine what it is. They say, oh, I'm constantly thinking, why are you not thinking of food all the time, right? So they don't understand that, oh, this can be quiet. And I've heard this from so many patients that they suddenly...
With GLP-1, it's silence.
Yeah.
When you're hungry, but...
But it wasn't even GLP-1, it was... With bariatric surgery, it was the same.
Okay.
We didn't talk so much about it. Now we see it more often. But with bariatric surgery, very often it was the same, right? That patients say, okay, because the medication and the surgery changes the biology. Me educating you is not going to change your biology. Me motivating you is not going to change your biology, right? Because the biology doesn't change. Right? The biology changes because of the medication, or the biology changes because of the surgery.
And
right?
by acknowledging that obesity is a disease, and it's a chronic disease, and we have to treat it. We
Yeah,
try to treat it.
which is fine. And a lot of people say, oh, so Dr. Sharma, you're saying we have to treat everybody with obesity lifelong. I say, okay, so what's the problem? Right? I mean, we treat everybody who has diabetes lifelong. We treat everybody who has hypertension lifelong. And people who have heart disease, we treat lifelong. So why are you against treating people with obesity for lifelong? Oh, yeah, because they should be doing this with diet. Well, if diet and exercise worked, we wouldn't be having this conversation.
And
right?
this also, when you treat obesity, you also improve cardiovascular problems
So many
and
things.
everything.
So many things, right? If you look at what are the health problems that you can get from when you have obesity, I mean, it's a long list. I mean, there's 200 conditions. Right? I mean, we can talk about sleep apnea, we can talk about, fatty liver disease, we can talk about people having joint pain, musculoskeletal problems, we can talk about if it affects your mood, people have depression, people have all kinds of problems, right? And then you treat obesity, and suddenly the whole health improves. Fatty liver gets better, sleep apnea gets better, heart failure gets better, blood pressure gets better, glucose, diabetes gets better, pain in their knees is much better, they feel much better, they have more energy.
But they need a doctor.
They
need a guide in everything. I want to say that again to each of those who are following us. You need a guide, a medical guide.
It's a medical treatment, right? This is not a do-it-yourself, I go to the internet and I order something and I try myself. No, we're talking about serious medicine that has to be used the way it is prescribed, under the supervision of a doctor, a medically trained person who knows what they're doing. And it's a powerful treatment. Right? And like any medical treatment, it has to be done under medical supervision. This is not a do-it-yourself weight loss thing, like some diet or some supplement you can order on the internet, which, by the way, never works. This is a medical condition which requires, you have to get a prescription from your doctor. Your doctor has to talk to you, has to explain what the treatment is. You have to follow the treatment. There are indications and contraindications for these medications. If you're taking medications for other conditions and you lose weight, then those medications have to be adjusted. So it's medicine, it's complicated, but okay, we do complicated stuff all the time.
Thank you very much, Professor. Thank you.
Thank you.
Thank you.
Thank you.